Hi, my name is Ashlyn. I'm a student nurse midwife. What's your name?
Lulu patient.
Is that what you like to be called by?
Lulu, yes.
Okay, great, Lulu. Well, it's nice to meet you. How are you doing today?
Oh, I've been better.
Okay, well, I'd like you to tell me a little bit about what brought you in today and how I can help you.
Well, I've been getting dizzy for the last couple days, and it makes me afraid at work, and I had to come home from work.
Okay. Tell me more about this dizziness. Is it come on gradually or is it all of a sudden?
No, it just seems like it's all of a sudden. I got out of my car and took a step, and then the world just went topsy-turvy.
Okay.
And it happened again, like when I got out of bed the other day.
Okay, so it's happened before as well?
Just over the last 2 days.
Okay. So yesterday and then today it happened?
It happened this morning again.
Okay, and this hasn't happened in the past at all?
I've never had it happen before.
Okay, spells last for?
I'm sorry?
How long do the dizzy spells last for?
Like a minute, maybe less.
And then they go away? No.
Yeah, they're gone, and I just kind of don't feel very good. I feel kind of sick, but
Okay.
that passed quickly too.
So besides the dizziness, what other symptoms are we having? You said some nausea?
Yeah, but not really anything else. It's just that I don't know when it's going to happen, so it makes me nervous.
Yeah, that can be scary when that hits you out of nowhere. So any headaches or blurry vision, ringing in your ears?
No.
Okay. And so you can't associate with anything, correct? It just comes on all of a sudden?
Right. Like, I mean, it happened when I got out of my car, and it happened when I got out of bed this morning.
So do you think it's related to going from more of a sitting to a standing position or laying to a standing position?
Maybe.
Okay.
I mean, I stand all day at work,
Mm-hmm.
and it didn't happen during work yesterday.
Okay. And is there anything you do that makes it go away faster, or is it kind of just resolve on its own?
No, it just goes when it goes.
Okay. And what is the dizziness like, a spinning or more of a lightheadedness?
Oh yeah, it's totally like the whole world just goes topsy-turvy and turns around me.
Okay. And you feel like you're going to faint?
A little bit.
Okay. Okay. Have you changed anything in your lifestyle, your diet, your medications, anything like that?
Not that I can think of.
Okay. And your activity level is the same?
Yeah, just work and home.
Okay.
I started a medication, but I don't think I've taken it before without any problems in the past, and I've been on it for 10 days, and this only started yesterday, so I don't think that's it.
Okay, what medication is it?
Oh, Prilosec, because I'm having a lot of that, that burning in my throat, and that's what the doctor told me to do the last time it happened, is take it for 2 weeks.
Okay, so some heartburn.
Yeah.
Okay, and that heartburn's pre-existing, you've had that before?
Oh, yeah.
Okay. Well, so when the dizziness comes on, I know you said it's kind of scary and it's unexpected. How else has it affected your lifestyle, your daily routine? Have you been able to go to work?
Well, I didn't go to work today because it happened when it happened when I went home yesterday, and it happened when I got out of bed this morning, and I was afraid to go to work because, there's machinery around, and if I fall at work and get dizzy, I could really hurt myself.
Mm-hmm. What do you do for a living?
I work at the packing plant in town.
Oh, okay. You enjoy it?
No.
It keeps you busy?
It's a good paying job.
Yeah, well, good. So have you, you said that you haven't had this happen ever before, correct? This is brand new within this week, past few days. Okay.
Right.
What do you feel like is going on? Do you have any clue?
No, I don't know.
Okay. We're gonna move on to me asking you more specific questions. Is there anything else concerning you that you'd like to bring up before I start that?
I don't think so.
Okay.
Other than that, heartburn, I've been feeling good.
Okay. And you're seeing a doctor for that, correct?
Well, I saw them in the past, and this is what they gave me, so I just picked up the same thing again.
Okay, good. Okay, so I'm going to ask you a few questions about your past medical history. Do you have any active medical problems or diagnosis?
I think just that heartburn.
Okay.
The one, and I've seen a doctor before because I have shoulder pain, but I know that's because of work.
Okay. Your blood pressure is normal.
Mm-hmm.
You know of? Okay, great. Do you exercise regularly?
Well, my job's really physical,
Mm-hmm.
so I don't do much besides that. I know the other doctor told me I should, but.
Okay. Well, that sounds like a pretty physically demanding job. For your childhood, did you have any illnesses that were significant?
I had a broken leg when I was 5,
Mm-hmm.
and I had a lot of ear infections growing up.
Okay. And did you receive antibiotics for those?
Yes, I think, yeah, that must have been what they gave me.
Okay. And they went away. Have you had any ear infections since?
Oh, not since like my early 20s.
Okay. Have you had any recent surgeries?
Mm-mm. No surgeries.
Any other recent illnesses?
No.
Okay. Do you know your last menstrual period? The last day of your menstrual cycle?
It was actually 2 years ago.
Okay. And do you have any allergies to medications?
Just penicillin.
Okay. And what kind of reaction did you have to that?
Got this really bad rash, like hives all over.
Okay. Do you have any allergies to foods or environmental allergies?
No.
Mm-hmm.
A little bit of like dust, or I don't know, dust, like springtime kind of makes me sneeze, but nothing bad. Okay.
And what medications are you currently taking? I know you said you had the Prilosec for your heartburn. Is there anything else?
And I do take a leave for the, like the muscle pain, but only as I need it. So usually like 3 or 4 times a week.
Okay. And all your childhood immunizations?
Yes.
Okay. And have you had the flu shot recently?
I had my flu shot at the beginning of winter. So they came around at work in, I don't know, October, November, something like that.
Okay. Have you had the varicella vaccine or the shingles vaccine?
I have not had that.
Okay. Has anyone else in your family suffered from similar symptoms of dizziness?
Not that I know of. It's
okay. And can I get your age and your date of birth?
I'm 51, and my birthday is 1166.
Mm-hmm. And so, have you had any recent exposures to anything, toxin, chemicals, or new medication? You said the Prilosec, I know, so forget that, but any toxins or chemicals?
No. I mean, yeah, I mean, they clean it's just basically bleach that we clean with, but that's been years for using that at work. That's not new.
That's not new. Okay. Tell me a little bit about your family life and your hobbies. What do you like to do?
Well, I'm pretty tired outside of work, so just kind of reading. Mm-hmm. So I do that. I have a nephew in the cities that I go to visit sometimes, but there's not a lot of time. Work is like 60 hours a week, so there's not a lot of extra time. Yeah,
that's a lot. How are your stress levels with that?
Pretty high, mm-hmm. But like I said, it's a good paying job. It pays the bills, and I'm still young enough. I can do this for a few more years.
That's a good attitude. We're going to move on to me asking you questions about all the systems of your body, if that's all right with you.
Okay.
Okay, great. So have you had any recent weight loss or gain?
I don't think so.
Okay.
Clothes still stay the same.
Okay. Any unusual fatigue or
Nah,
weakness?
just usual.
Okay. And how's your sleep?
I sleep pretty good. Sometimes I need to take the Aleve because I can't sleep if the pain's bad, but the Aleve really helps and I sleep fine then.
Okay. Tell me more about your pain. How severe is it?
Oh, when it gets really bad, it's probably like a 7, and otherwise it's just a nuisance. It just depends on what I've done at work that day. If I've used that arm all day long, or if I got to switch between jobs, then it's not so bad.
Okay. And does anything help besides the Aleve? Do you stretch it or do warm compacts or anything?
The warmth I haven't really done. We do stretches sometimes together as a group at work before we start. So I do those with everybody else.
Okay. And do you have that pain every day or does it come and go?
I mean, there's a little bit of an achiness to it, but it's not, it's like I said, it's only really bad on days where I do the same job the whole day and really use that arm.
Okay. Okay, great. Have you ever had any issues with your ears besides the ear infections, earache, or ringing in the ears, or issues with your hearing?
No, I think I hear okay. They haven't been a problem since like I said, like in my 20s, my early 20s.
Okay. And how's your vision? I noticed you're wearing glasses.
I can see without my glasses, but my glasses help me to read and to see further for driving.
Okay. So are they?
And I'm just kind of used to them, and I have, so they stay on all the time.
Okay. Have you had any blurry vision or double vision?
No.
Okay. Any issues with breathing?
Nope.
Okay. And then have you had any chest pain or discomfort or shortness of breath?
I don't think so. Only, I mean, I get short of breath if I try to run up the stairs several times in a row, but I think that's normal.
Yeah, especially working all day with boxes and lifting things. And have you had any cramping of your legs or pain with walking?
Mm-mm.
Okay. And with the episodes, have you ever fainted? Or you just felt like you were?
Oh, no, I haven't like blackout. No.
Okay. Okay. And then do you have any issues with the heat or cold intolerance?
Yeah. No, I don't think so. I think I'm pretty normal.
Okay.
So, like, I don't get extra. I mean, I'm not wearing a t-shirt in the middle of winter, and I'm not sweating all the time in the middle of summer. So.
Okay, great. Well, I think I have everything I need as far as asking you questions. Is there anything else you'd like to bring up or talk about that I can help you with?
No, just this dizziness.
Okay. Well, we're going to do a physical exam now, and I'll take a look over everything, and we'll try to get to the bottom of this dizziness.
Okay.